my class. Okay, so what public health is? As I said, that public health is not only science as well as this is an art. So in public health, what we try to do is all about preventing diseases and then how we can prolong life. When I'm talking about life, it is not individual life, it is as a community as a whole, and then promoting their health in a organized effort. So this organized effort is at a community level. So the basic difference what we are having in community or public health is in public health, what we see is community at a large. Whatever program we talk about, government health programs. So every health program is having a each and every health program is a community angle. So none of the health programs taken care by government of India is taking care of individual health. It is community at a large. So like if you take COVID vaccination, which was done by government of India at a mass level, no. So you might have heard incidences one or two that people had side effects, people died, or no, news like that cropped up in the media. So when government thought of rolling out of COVID immunization, they considered that this might be fruitful or helpful in saving people's life or saving people from COVID infection for 90%, 95%. So whenever they are thinking of a rolling out of a community intervention or a community program, they think about masses. They were aware that there will be a few cases where it is not going to work or where some of the cases there might be a side effect, but they thought that at a large, most of the people of the community, they will be no beneficial effect. So that's how they rolled out with community no COVID immunization program. Similarly, when you will see routine immunization of children no of any country. So at some of the immunization program, they might be having a side effect of having severe fever, loose motion. So these are always their side effect, associated with some or the other health program. But as I said, that at a larger picture, what government or the policy making people, they think community as a large. So when people above 90%, 95%, or 99%, they are going to have beneficial effect. 1 or 2% always have some adverse effect associated with it. As I said, it is that public health is concerned with the health of the population and not about curative part. It what public health talks about is preventive aspect. What we will do so that disease will not spread. No. So events or efforts of government is organized by society to protect, promote, and restore the of public health. So everything is focused at society level or community level. So it is a combination of science, skills, and belief that is directed to maintain and improve the health of the people. Now coming to definitions. So there are three definitions which are quoted in my slide. First one is Winslow. Winslow has given a definition. What is public health? The science and art of preventing disease, prolonging life, and promoting health through organized effort. So Winslow's definition is the highly used, and most of the time this definition is quoted. So as I said that there are multiple definitions given by multiple persons or organizations. So whenever you are quoting an definition, you should always quote this has been given by whom. So first one is by Winslow. Second one is Oxford Textbook of Public Health, which is again highly referred textbook. So, as per this textbook, public health is a process of mobilizing and engaging local, state, national, and international resources. So, see, uh, this definition gives an approach of bottom to top approach. So, it starts from local level, community level, and through state, national and international. It goes up towards the pyramid. So, the process and of mobilizing and engaging these resources are to ensure the condition in which people can be healthy. So they talk about engaging multiple resources, and these resources are engaged or mobilized to assure a very healthy environment. Third definition is quoted by WHO. So, as per WHO, public health aims to provide maximum benefit for the largest number of the people. So, if you will go through this definition, so whatever example I quoted out of immunization, whether COVID or routine immunization, so this definition clearly says that public health aims to provide maximum benefit to the larger number of people. So in statistics, there is a term which is called outlier. So whenever you will see a population curve, there are certain outliers who might not be benefited by certain health programs, certain interventions. So government always go ahead and then think about the normally distributed population. These outliers are not taken care, and then if it is impacting or benefiting a larger number of population, so they go ahead with that program. So these are the three definitions. If they ask definition in your exam, you can quote any one of those. Now we will talk about history of public health. So how public health has gone across multiple eras. So if you will see history of public health, it starts from 550 BC, before Christ. What has happened before this? So if you will see the Indus Valley civilization, so you can see there were evidences of bathrooms. Now, if you might, there might be in your brain coming up in health while we are talking about bathrooms and drains. So this is just to highlight that public health is not about health, medicine. There is a preventive aspect. So having bathroom, having drains shows that how that civilization was sensitized towards having a having a hygienic environment, having good sanitation. So the examples of having home, sewer, drainage system comes from a time period which was 500 BC, before Christ. And then there is a book of Leviticus, which is quoted, and this book is supposed to be 1500 BC, before Christ. So they talk about personal cleanliness, sanitation, disinfections of bell, isolations of leper. So you can see that leprosy existed that time. And then since bell was a closed system, from people used to take out water for drinking purposes, so they used to sanitize those bells. Even in this era where people are having well, you might come across bells which are not being sanitized, and then people are using water of that. So if you will see how the things has developed up in classical cultures, 500 BC to 500 AD, what has happened? So public health was practiced as Olympics for physical fitness. Community sanitation, water wells, all these sewer system, regulation of street cleaning, these all things you can see over there. In Middle Ages, again leprosy, plague, health problems, they were very common, and people consider these health problems as a spiritual problem. You did something wrong, that's why spiritual power is cursing us or something like that. So in that era, you can see syphilis also. No, this was one of the deadliest epidemic. So then came era of Renaissance. So during that period, uh, there was a belief the public health system developed, and people were more oriented towards health aspect, that they started believing that certain diseases spread by environment. The example is malaria. They thought that there is bad air or polluted air, because of which malaria propped up and cropped up in their community. So in 18th century, problem of industrialization. So industrialization was very rampant during that period, and during the same period, vaccination was invented for smallpox. So I have tried to put up multiple historical markers across timeline when what came and which was more prominent and prominent in terms of public health. How this is across timeline, how it has developed. So if you want, I will save this slide. You can go through that. So you can see fluorescent night angle came in 1854. Then John Snow theory you can learn about, where a spread of waterborne cholera is most talked about. Then 1796, Edward Jenner developed. I talked about that vaccination against smallpox. So these are landmark in public health these eras. So 1858, you can see Louis Pasteur talked about a spontaneous generation of life. Then 1859, Charles Darwin theory came. Then 1862, Louis Pasteur talked about microbial causes of disease. 1876, anthrax was discovered by Robert Koch. 1946. This is in modern time when WHO was founded. So this is across the time period how things has happened. Now, as I said, if you will think of evolution of public health in bullets, what all things has happened. So vaccination was a game turner. So uh, at present, routine immunization or universal immunization health program in India talks about vaccine preventable diseases. So these vaccine preventable diseases like polio, BCG, tetanus, measles, all these developed no, just because of the time period, like people develop vaccines across that time. So vaccination is one of the evolutions of public health. Now, in public health, we talk about motor safety, motor vehicle safety, traffic accident. This is also one of the aspects of public health. Now, safe workplaces. How we can make workplaces safe, so that when we are talking about safe workplaces, that should be ergonomically assessed, like at what angle your laptop should be there, how much difference it will be in the chair and table, at what height you are going to put your laptop, so how you are going to lift a heavy object. So all these aspects are over there, which should be ergonomically assessed in an industry. So people talk about safe workplaces. Now, control of infectious disease. Now at present, we always come across deadly disease which are mostly infectious, like COVID, HIV, TB. All these are infectious disease. So no, these all things are covered under public health. Now there is something called communicable disease. There are something called non-communicable disease. Now non-communicable diseases are cardiac problems, blood pressure, mental disorder. These are non communicable diseases. So these also comes under purview of public health. Now, safer and healthier foods. Again, this is a part of public health. Healthier mother and babies, family planning, recognition. So I have jotted down certain issues which are uh, under preview of public health, and then that's how the evolution of public health has been. Initially, people thought about that. Okay, public health will be just about sanitation. Then they thought no, it should be health also. Then people started talking about food also. People started talking about industry also. People talking about started about talking about tobacco also. Now in some of the countries, people talk public health as homelessness, people not having home. That also comes under preview of public health. But in India, we have not gone that far. We are still struggling with communicable, non-communicable diseases, and then recently mental health has been also appreciated and anticipated as a problem in India. So similarly, food safety or industrial safety, these components are very new. Initially, people had been talking about infectious disease, then non-infectious disease, then maternal and child health. That's how the growth of public health has gone in India. So now we will try to understand difference between community health, clinical medicine, and public health. The community health, when we talk about community health. So the community word itself signifies a group of people. So community health is all about health status of a defined group of people and the actions and the conditions, both private and so this community health does not involve only government. This involves private players also. So what they do to promote, protect, and preserve the health. So this is community health. Now, whereas public health refers to health status of a defined group of people and the government actions. So this is very clear. Community health can be taken care by both private and public part, whereas public health refers to health status of a defined group of people as community health, and the here the government takes actions to promote. Here we don't have any private player. Now clinical medicine, what is clinical medicine? Clinical medicine is considered with diagnosis and treating. So here, as I said, that curative aspect comes. We will identify the disease and then we will try to cure the disease. And clinical medicine mostly talk about individual cases. They don't talk about community as a whole. So overall objective of public health and clinical medicine is better health, but one talks about better health of an individual, which is clinical medicine, whereas public health talks about clinical health of a society, how society is going to be better. So both are vital and interdependent. If we are not going to take care of individual health, definitely community at a large is going to suffer. So, ready to access health quality services is a right of population. So, this is something where we are talking about right of health, like right to education, right to information. So, similarly, there is a right of having health, no good health. This is a right of people so that they can access quality healthcare services. This is the right of the population. Now, this requires the availability of high quality providers. So, these health providers can be a doctor, which is a clinical part, and then public health personnel, which can be preventive care aspect. So, as I said, public health include immunization of children, birth control, hypertension, diabetes, both communicable disease, non-communicable disease, maternal and child health, routine immunization. So everything comes under environmental safety, assurance of safe water and supply, sewage disposal, improved nutrition. So there are multiple prongs of public health. One can be reproductive and child health. One can be wash, where is water sanitation and hygiene. One can be nutrition, which talks about food also. So one prong can be communicable disease, one prong can be non-communicable disease. So this is basically the difference between public health model and medical model. So you can see in public health model there are multiple people, community at a large or society at a large, whereas in medical model you can see always the model focuses on a single individual. But as I said, this model is also important and both these model go in hand, because until or unless one person is not going to be taken care, suppose that person is having an infection, take example of TB. So if that individual case of TB case, if we are not going to take care, this person will go into the community and will spread TB to multiple other, so this cases will be increasing in society in multiple propagation. So preventive as well as curative, both should go hand in hand. So as I said, public health model talks about population, medical model talks about individual. Public health model talks about preventive aspect, curative aspect. Medical model talks about diagnosis and curative aspect. Public health model talks about health promotion in terms of how we can prevent community at a large with their healthy behavior so that they should not get any diseases. Now medical model talks about treatment, because there those cases only go who are suffering or who are having some disease. So public health model interventions can be in terms of healthy environment, healthy behavior, whereas no, medical model intervention can be in terms of medical care. Now, what are the core activities of public health which one should focus on, and then it is one of the frequently asked questions in the exams. So, what are those core activities? So, the core activities are preventing epidemic and spread of disease. So, you should know what is endemic, what is epidemic. This basically the disease should not spread at a large level in the community. Now, public health protects against environmental hazard. This environmental hazard can be, drought, this can be flood, or this can be, earthquake. So this talks about protecting community health during those environmental hazards. So public health also talks about, as I said, response to disaster and assist communities in recovery, how we can rehabilitate community back to normalcy. uh, uh, Public health also talks about preventing injuries, as I said, motor vehicle or road safety. This is that component. It promotes healthy behavior in terms of, doing exercise, having healthy food, not getting addicted to tobacco, and alcohol. No, so these aspects, yeah, Suchita. These aspects we have to ensure through promoting healthy behavior. Then public health also talks about quality, accessibility, and accountability of the health services. So there are certain quality standards which government of India has started incorporating in its, program. So there is something called Kaya Kalp accreditation. There is NQAS accreditation. There is Muskan accreditation. So Muskan accreditation talks about the services which are going to improve the services of child health in a government hospital. Kaya Kalp is more towards, making the health facility more hygienic, more clean. And NQAS talks about, providing uh, better facilities across all the departments in a facility. So there are multiple indicators at which it is being assessed. So we are going, further and further covering, a larger milestone, where initially we had been struggling hard to provide services. Now this is an era where the services are reaching to the people, or the policy maker or the advocacy people has started talking about giving quality services. Now, monitoring of these health status of the population also comes under the activities of the public health. So, public health does not talk about only intervention or implementation. It also talks about monitoring, of those intervention in terms of monitoring the health status of the population. It also talks about mobilizing community. So, a very frequently quoted example in public health is a time where a uh, focus special focus was on to ensure a special focus was on to ensure that none of the child goes un uh, uh, none of the child goes without being vaccinated. So there had been multiple, problems, like in giving vaccination. There was a rumor that if your child will be given polio vaccination, your child will become, important. They will not have children in the future. So all these barriers were, taken care by government through miking, through involving uh, faith-based leader, community leader, to ensure that the community is mobilized at large and no one is being left. Everyone gets the last milestone services provided by the government. So no, reaching out to link high risk and hard to reach people. So when we are thinking talking about linking high risk, so high risk especially comes in terms of HIV/AIDS. So government has identified certain high risk behaviors, which can be in terms of migration, which can be in terms of, truck drivers, which can be in terms of people who are using taking intravenous drugs. So all these people has been identified and they has been taken care by government through targeted intervention. This population was identified, their risk behaviors was identified, and then government of India, involving multiple stakeholders, specifically planned intervention for them. Yes, these PPTs will be shared with you. No issues in that. Then public health also talks about research. So research, is anyone trying to say something? I can see a murmur. Anyone wants to say something?
May I ask a question, sir?
Yeah, please.
When I go through the slide and as per your presentation, sir, in my understanding, this community health and public health are almost similar. So, can you
Yeah,
please highlight the
public
difference?
public health and community health is almost similar, correctly said by you. The main difference comes into clinical medicine and public health. Okay. Uh, Give me a minute. So, as I said, public health focuses more on the general public community health, right? Public health focuses on the general public, whereas community health, the basic difference is public health is public at large, whereas community health focuses in a specific area. Okay, so here comes the difference in the nomenclature. Public health, every public is like, as I said, community immunization program. So immunization program was being rolled out, taking care of each and every no citizen of India, whereas community health is like, no, we are targeting a specific population, a specific tribe, or a specific geographic area covering a specific people. Now this is clear. Whereas rest of the aspect, like individual or population, so community health as well as public health both covers uh, a large number of population, whereas clinical medicine covers a individual, the subset is individual, whereas community health and public health both are having larger number of population, which is at focus. I hope I am clear.
Yes, sir. Sir, can I represent my understanding, sir?
Yeah, please.
Sir, as per my knowledge, after listening your explanation, sir, my understanding is public health is for general public,
Yes.
and community health is for a group of defined community.
Yes, it can be a group of defined community.
We
Like
have some common diseases or some
yes,
prevalence like.
exactly. Like I am when we talk about uh, a specific, dengue outbreak. Okay,
Yes, sir.
in a community, so that becomes as a part of community health to take care of dengue problem in a community. Now, government of India or any state government runs a program called NVDCP. Okay, right, National Vector Borne Disease Control Program. So
Yes, sir.
this disease control program is a public health program, right?
Yes.
So under this program, what we do, we ensure we do indoor fogging, no, outdoor fogging and indoor residual spray on a living larva in the drains and the wells, so that mosquitoes should not grow over there, right? Whereas once that disease outbreak already is there, like malaria outbreak, dengue outbreak, we is already reported in the community. So a group of people go over there in that specific area to contain the disease. Okay, so containing that disease is a part of community health. They do go, they take care of the health all those who are suffering are being provided medicine, whereas the focused, uh, contact tracing from where the first case came and then how it went up to further houses. So these all are being taken care. So community health is having preventive aspect also and curative aspect also, whereas public health is at large only about ensuring that we don't have that disease. We try to prevent the disease before it sets in. Hope I am clear.
Yes, sir. Thank you, sir.
Okay. So I think we were on the last PPT. Okay. So as I said, it talks about research also. So we always do a hypothesis. No, we develop a hypothesis, and then we try to test whether our hypothesis is right or wrong. Like suppose no, we do not know. Okay, there is a disease outbreak every year in Bihar, which is called AES, acute encephalitis syndrome. So there was a hypothesis that this this disease spreads from lychee. Lychee is a fruit. There were a researcher who had a developed a hypothesis that sorry. So they developed a hypothesis that this disease, acute encephalitis syndrome, is just because of lychee. The people eating lychee, unripe lychee. There was another hypothesis which says no, this spread just because of have not living in a healthy environment. There is all dust around, pigs spreading filth around. So there are multiple hypotheses. Then someone developed a hypothesis. No, 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 no. This is not all because of that. This is all because of hypoglycemia. So still there are multiple hypotheses which is being discussed across medical fraternities, and no one has narrowed down that it is just because of what. So someday some other hypothesis will come and then probably nullify the other hypothesis. So public health also talks about research where we develop hypothesis. Okay, this might have spread because of that. That might have spread because of that. So ultimate aim of all these hypotheses testing and then research is to come up with a solution where we are going to target community at a large, so that that disease is not going to spread further. Now the 11th point talks about leading development of sound health policy. So once having said all this, developing intervention, preventing epidemic, doing research, finding out high risk people behavior, hard. Okay, there's something called hard to reach people. So no, there are certain populations in India which are living in hard to reach terrain. Like when we talk about northeast is always hard to reach terrain because it's a hilly area, and no climate is always not good. So it's very hard for healthcare workers to work in those areas. Similarly, people living in flood prone areas, these are identified as hard to reach areas by government of India. So no, be identified everything, be characterized hard to reach area, high risk people, how to do mobilizing community. So to all that, taking care of all these points, public health also talks about developing a policy and planning level. So for that also, no, ultimately everything should curl down for towards developing a good healthy policy. Now, if you see, you want to read about good health policies across globe, read about Obama health policy, and recently government of India has started a program called Ayushman Bhava. So which people say that it's a replica of Obama health policy, probably renamed by Ayushman Bhava, where certain components has been changed. So these are certain good health policies which you can see, and then you can see come across meticulous planning, where population at a large is the focus, and then these policies talks about more of preventive aspect than curative aspect. So I think this was my last slide. If anyone is having questions, I'm ready to answer them, and then I will be sharing these slides with Seema, and then she can send it to you guys. I hope that is okay with you people.